Hello, everyone. I hope you're enjoying your day. I just want to give some introduction and very small details about the course that we've prepared for general practitioners, the orthodontic course for general practitioners. This course is in partnership with Palmieri Media Group, and it's based on 7 sessions of a full day course. Which 5 days of the course is theoretical. We talk about the concepts of orthodontics, the art of patient selection, and also how to plan the treatment for the orthodontic patient, and we also how to diagnose and also how to plan the treatment. And also then I'll show you more than 200 cases of orthodontic patients in order so you can find the similarity between these slides that I will show you about how to diagnose and how to plan the treatment for them. And also then you can go for your treat your diagnose and treat your patients that are coming to your office. Then we'll have two in-person, hands-on full days, which I will speak about how to position your brackets, how to use the fixed appliances, and also how to use the removable appliances, functional appliances. So it's a hands-on course that the 2 days hands-on course will be added to the theoretical, that 5 sessions and I was talking about. And then half day we'll talk about the clear aligners. If you're working with Invisalign, if you're working with Perfect Smile, Sure Smile, whatever you're talking with, you have to have a concept of how to implement clear aligners in your practice. So half day of this course, because with these improvement and progress of this AI and all these treatments that you can have with clear aligners, you must have to know about the implications of them in your practice. But without any concept of orthodontics, you cannot do any aligners. First, you have to have some concepts of orthodontic treatment, orthodontic diagnosis, and then go to treatment. If you're just going with no knowledge about orthodontics and offering your patients clear aligners, I think it's a mistake. So we will try to actually speak about these things in the courses that and the next one will start in September 2023. In order to give you some idea about what you will learn in the course, I'll run through some few slides. Then you'll get the better idea that what we are going to talk about in this course. We'll start about why adding orthodontics to your practice is beneficial for you. So as a general practitioner, if you add orthodontics, you can add orthodontics to your practice. Definitely it will be profitable for you, and then you'll get more and more patients. So it will not only help the other parts of your practice, but also seeing and treating the orthodontic patients will be also beneficial for you. So that's got 2 parts. We will talk about that and how to implement orthodontics. One thing that I always say to the general practitioners who are seeking to learn about orthodontics is that orthodontics is actually you don't have to do any physical thing with that. But you have, it's like, if you compare it with some sports, it's like chess. You don't have to be tall to play. When you're playing basketball, for example, you have to be, I don't know, 6'7", 6'5", to have that height to play basketball. If you're playing, I don't know, hockey, you have to be strong. You have to be very fast. If you want to, but orthodontics, comparing to the other branches of dentistry, you don't have to be artist. Especially nowadays with the help of the AI component, which has been added to the orthodontic treatments, it's much easier. But you have to have the strategy. You have to diagnose your patient. You have to plan a treatment for your patient, because that's the most important thing. In order to diagnose and to treat, you have to have to know the art of patient selection. Because you are, as a general dentist, even as an orthodontist, sometimes you want to, not sometimes, always you want to make your patient happy and to have the best results. So why to select very complicated cases or complicated cases that you cannot treat? In order to know the art of the patient selection, we have to, in orthodontics, you have to go to some basics. You have to know about class 1, class 2, class 3. Without knowing these things, and these things, then you will not, you're not able to actually have a good diagnosis of your patient, and also to plan a very nice treatment, to have a very nice treatment planning for your patient, because everyone is looking for a result. So we have to go to the basics. I always tell the dentists that are coming to my course, maybe the first session is not very, it's a little bit boring, because we have to go through basics. But I'm not talking about embryology or what is happening in growth and development when the child is still in the embryo. So, but you have to know about even some growth, some timing of the growth, some timing of the eruption of the teeth, in order to help your patients to have a better result, and also to have some, to help them. Not so sometimes you can prevent some very complicated orthodontic cases. So we have to go to, I will show you so many slides in order to see what is class 1, what is class 2, what is class division 2, for example, class 2 division 2, what's class 3. And then when the patient comes to you, you can identify their problem very much better. Then, for this reason, we have to know the cephalometric analysis. Nowadays, you can ask your radiologist, or if you refer them to some radiologists, or there are numerous softwares that you can actually use them and have the cephalometric analysis with that. But the thing is that you have to interpret them. With some, because there are so many points, there are so many lines, there are so many angles that you'll get mixed up. I will give you some few points, some few lines, some few angles, and with that few angles and few lines, then you can have a better interpretation of the cephalometric analysis, which is very necessary for anyone who wants to treat a patient. Then, because with these AI things that are implemented in the things, you can have the cephalometric analysis. You can have so many change. You can make so many changes virtually to the to what. But you have to interpret. You have to know what this cephalometric analysis shows you, but with some few points and angles and lines, I will teach you how to have a better analysis of your patients. Then combining the cephalometric analysis with the clinical examination and with your knowledge of these three things, you can then you will know your limitations, because you cannot treat all the orthodontic problems with orthodontics, because sometimes you have to do orthosurgery, or you have to do sometimes the patient just needs some restoration, some I don't know, composite veneers, laminates, or something else will help them. So in order combining these cephalometric analysis and also to know what are the limitations, then you can go and have the best treatment plan for your patient. So then you can select, because the most important thing in dentistry is how to actually select the cases, and also what not to select. I will teach you how to identify these cases that you can treat, and what not go after treatment. Even these some cases which cannot be treated by an orthodontist. So, but there's lots of patients that you can work on. You can treat them. Growth modification, cross bites, crowdings, localized spacing, uprighting, and space regaining, which this last one is actually a part of adjunctive orthodontics that will help the other treatments that they are doing. If you just upright, then you can have a better implant there, or you can, if you distribute the space, you can have a better restorations for your patient. So I will talk about how to select your patient, and then you can choose the appliance or the technique that you want to. You can either treat the patient with a very simple removable appliance, or just a little bit complicated removable appliance, or you can help the patient with the fixed orthodontics, braces, or you can actually use the clear aligners. Then these are the instruments that you're using for treating your patient. But first, you have to select your patient. So in order to identify what is the problem, if you have got a very an overjet like this, or you can use some functional appliances. I will teach you how to get the impression for that, how to diagnose, and when to start for the patient in order to have some results like this. And then I will for some space regaining, when you have got lateral missing, how to actually distribute the space, and how to open the space, or how to close the space, because these are two different things. Are you opening the space for lateral missing, or are you closing? I will teach you how to identify them, and how to help these kind of patients in various growth period that they are in. If they're in primary dentition, or mixed dentition, or also if after they're having their permanent dentition, to how to help the kids, or how to also help the adults. As I've told you, I will show you more than 250 patients from the first, in the middle, and also at the end. How to diagnose these patients. So with these, when you see so many slides, so many patients, then you get familiar with the malocclusion and then when your patient comes to your practice, you can say, okay, I've seen some similar cases in the course. Now I know how to diagnose, how to treat this patient. If the patient is good for my practice, it's better to select her or him for my practice and to continue with that. So there's so many slides about crowdings, about open bites, about deep bites, how to use the instruments, the elastics, the braces, even removable appliance in your practice. We'll talk about them. We'll talk about photography for your patient, which is one of the important things in orthodontics, because that will be a good record for you. Then it's very simple. We'll have a hands-on, but something like 45 minutes, 1 hour hands-on on photography, and I'll teach you how to take photographs for orthodontics with your iPhone, with your actually mobile phones, or if you have a professional camera, that will be better. But I will also teach that because it's a very important issue there. And then we'll talk about some record keeping, showing so many slides about what the patients that are treated. So our next course will start in September 2023. Most of our sessions are based on weekends, but not compacted in just 1 week. It takes something like a month and a half. Most of the weekends we are a little bit flexible. We can, if the course starts, we'll ask if you can come. If for theoretical or didactic sessions, you can also have it online. So if you're not based in Toronto and you're far from here, you can have or take the didactic parts online via Zoom, and then, but it's an interactive sessions. So you can ask the questions there and all the things. But if you're near, come to the class, and we will talk about more about this. But the hands-on sessions, which we've got 2 sessions of hands-on on the models, unfortunately we cannot have it online. Then if you need more information about the course, you can visit our website, go to our social media, and if you've got any question, also you can WhatsApp me or WhatsApp Eversmiles in order to have more information about the courses, about the fee, the tuition fee. And one thing I just want to add, we are having a study club for all the general dentists that have been to this course. We're trying to have it quarterly, in person, and this is the place that you can share. We've got a virtual study club, but we want to have also a complimentary in-person study club quarterly, so you can come there, share your patients, share your experience in orthodontics, and with the other colleagues, or with me, or I will invite also some orthodontists to be there. If you have any concern or questions, and you want to share your experience to actually get the experience of your colleagues, that will be a good thing. So hope to see you in the course, which, as I told you, the next one will start in September 2023. Thank you.